Parasympathetic system has these three functions: inhibition of contraction, relaxation of detrusor muscle, and constriction of the internal uterus sphincter. So coming to the neurogenic bladder. Neurogenic bladder, we already discussed something according about the mechanism. Now, where is the lesion? The question is, where is the lesion? If the lesion is between the brain and the pons, there is overactive bladder, because I informed you that brain controls the pons micturition center. When the brain, there is problem with the brain, that for example there is stroke, or there is Parkinson's disease, Scheidegger disease, or any brain tumor, then this inhibition is vanished, and what happens that bladder is overactive. One point important is that in case of stroke, 25% of the patient first go into retention because of the spinal shock. Later on, they develop this overactive bladder. What is overactive bladder? Overactive bladder is that detrusor is hyperactive, and there is constant urge to evacuate, and even after evacuation there is still need, or there is still feeling that it is not completely empty. The second thing is that the lesion is between pons and the this spine. So the bladder is here, in this case, is overactive bladder plus detrusor sphincter dyssynergia. What is detrusor sphincter dyssynergia? Detrusor sphincter dyssynergia is that detrusor sphincter dyssynergia means that the external sphincter, that is external urethral sphincter, that is supplied by pudendal nerve from S2 to S4, it causes the sphincter to contract. At the same time, the bladder is spastic. So the bladder is spastic, and the external urethral sphincter is also contracted. So there is urge to evacuate, but only small amount of urine is passed because of the constricted sphincter. So this is called detrusor sphincter dyssynergia. It's present when the lesion is from pons to spine, sacral spine. So one important thing is T6 lesion. When you have T6 lesion, there is autonomic dysreflexia. What is autonomic dysreflexia? That means that whenever you try to pass any instrument through the bladder or the rectum, there is sympathetic overactivity, there is hypertension, sweating, or even the patient can go into shock. So it's important that the treatment is chlorpromazine, and tirazosin can be given prophylactically. So you should know about autonomic dysreflexia that can occur when you pass an instrument through bladder or the rectum, and the lesion is at T6 level. Below T6 level is also overactive bladder with detrusor sphincter dyssynergia, but there is also upgoing plantar. So, uh, coming next to the peripheral nerves, in peripheral nerves there is basically damage to the nerves, and what happens that bladder cannot sense that it is full, so it keeps on filling, and at times it goes into retention, and after retention then it there's a limit beyond which it cannot fill, and then there is overflow incontinence. So in these regions we have overflow incontinence. Examples of overflow incontinence can be diabetes, tabes dorsalis, or other peripheral lesions. Then, so basically, this is the main thing. Where is the lesion is important.